By now, many of you have probably seen the viral video about Dr. Potter, who is the breast surgeon who had to step out of the operating room to get approval for her patient to stay overnight after a major surgery from United Healthcare. Since she posted that video, United Healthcare has sent her a cease and desist letter demanding that she apologize for the video that she posted and to say that she did everything incorrectly. So physicians are coming forward and sharing our stories because the cease and desist is just wrong. And I want to tell you about one of my favorite United Healthcare stories, and it's nowhere near as egregious as what happened to Dr. Potter, but just to give you an idea of why I have stepped away from the insurance market, or why I stopped taking insurance at my practice. So I have a patient who has lost a lot of weight after a lot of hard work, bariatric surgery, diet, exercise, medication. She's lost over 150 pounds, which is amazing. She actually works for United Healthcare. She works for them, right? So she knows the system inside and out. Unfortunately, after her weight loss, she has developed a lot of sagging skin, and this skin is so problematic that it breaks open, it causes rashes, like she'll get blisters, like she gets some really awful skin conditions that have gotten infected because of the excess skin that she has. So she should be approved for skin removal surgery or a plasty after having all the weight loss. So she knew all the protocols, everything that United Healthcare wants to require of patients to do before they get the skin removal surgery. She had a surgical date set with her surgeon, everything was up to par, checked all the boxes, right? And her surgery gets denied. Just gets denied. And so she calls me because her surgeon refuses to do a prior authorization. And I don't blame that surgeon, because at the time that the surgeon wanted to do the prior authorization was actually the time when United Healthcare had that cyber crisis, which cut off payments to physicians' offices. So no one's motivated to have to fight harder to not get paid. So her doctor didn't do the authorization. So I called trying to do the authorization on her behalf. We were on the phone for over an hour. And they said, you know what? You have to do a peer-to-peer with a physician. And if you called yesterday, you could talk to somebody, or if you call tomorrow, you can talk to somebody, but you can't talk to somebody today. It was ridiculous. So I asked to do an appeal, and they sent me to the appeals department, got sent in circles. Appeals couldn't help me. They sent me to another department. So I'm on the phone with the patient for over an hour, and we get sent to a department where they told my patient, who was on the phone with us, mind you, that she actually did not have any medical coverage with United. She only had vision and dental. Now, she knows this is wrong because she works for the darn company. She knows her benefits better than anybody. But this is just the tactics that they use to delay, deny, delay, deny. I was happy she was on the phone with me because she got to see what physicians go through when we try to do these aspects for patients. We don't have time to spend an hour on the phone getting spent around with these insurance companies when we have patients to see. This clogs up our ability to see our other patients when we did everything right. So this patient to this day still has not gotten her surgery, even though she followed all the rules. She works for the company, should have these benefits. It's been delayed, denied. They're getting to keep all her premiums, and she's yet to have surgery. So Dr. Potter, we believe you. We got you. And I encourage my other physicians to come through with their stories as well. Thank you.
Dr. Potter, United sent me a letter, which I'm going to share in its entirety here, and they denied my patient's overnight stay. I'm going to let their words speak for themselves. What I have to say is that my words were true, and I was honest in my statement in the video. And I'm sure you'll have questions after you read United's letter, and I'm happy to respond to those in some other forum. I'm not going to be silenced by threats when it comes to speaking out for my patients and for my ability to take care of them and for what's going on in the healthcare system. If I don't speak out, then I lose. I lose my integrity, and I lose my voice, and I lose the opportunity to make a difference. And although it is a bit intimidating to have a company like United send a letter like this to me, I know where I stand. I'm a woman taking care of women who are affected by breast cancer, and I know that I do that with all of my heart and in a way that I can be proud of. And I spoke up when I needed to, and I'll keep speaking up. So I would just ask you guys to follow along, share this story and this letter in your communities, because I think that I'm not the only one. And it is scary to stand up against the healthcare system when it's such a wealthy and powerful group of organizations. But it's going to take all of us telling our stories and being honest to make a change. And I am here for it. So yeah, here we go.